First, on the American health front, most people really don't know what an endodontist does. But the term root canal is a different story. If a tooth has a large cavity or trauma, the pulp of the tooth may become damaged or infected, resulting in pain or possible loss of the tooth. Root canal treatment is one of the most common procedures which can save your tooth and relieve pain. Over 14 million root canals are performed every year. We spoke with Dr. Richard Bauman, one of Salt Lake City's leading endodontists, to learn how technology is improving the comfort and success of root canal therapy.
Yeah, root canals sort of have a bad reputation. Everyone has heard a horror story. And some root canals are difficult for us to get you numb. So that's the biggest important job that I have, is to make sure that you're numb. If you're numb, most root canals are not really a big deal. You really don't feel anything. A lot of people sleep through them, so they're fairly comfortable. And not all root canals are created equal. Just because one person had, an infection or some issue doesn't mean that every root canal will be the same. So most of the time with today's technology, root canals really can be painless. Root canal treatments let us clean out the diseased tissue inside of a tooth so that patients can keep the tooth. Years ago, many teeth would have to be extracted or pulled out due to pain from this inflamed or infected tissue inside the tooth roots.
Although root canals are often associated with a painful experience, this procedure has evolved significantly over the last few years. Today, root canal therapy is faster, more successful, and relatively pain-free.
Although many general dentists perform root canal treatments themselves, they also sometimes refer patients to endodontists because some root canal treatments can be pretty challenging. When the experience and additional training of an endodontist is combined with some of the new technologies we have, root canal treatments become more predictable, more efficient, and more comfortable.
Now let's learn what technologies have most influenced the changes in root canal treatment.
The most significant change in root canal treatment is the operating microscope. Microscopes provide up to 25 times more magnification than the human eye. This magnification is needed to locate small, calcified, or hidden canals and cracks in the tooth. One of the most common reasons root canal therapy doesn't work or must be redone is because of a missed canal. And patients will often ask me, their first question is, well, why didn't they find the canal the first time? Finding these canals is difficult, and every tooth's different. Not every tooth has the same number of canals, so you must know where to look and have a microscope to safely drill deep into the root to locate these canals. Here's an example of what a tooth looks like when we first enter it. No canals are really visible. As we continue to look in this area, we find some. Tooth usually has 2 canals in this area, but in this case it ended up having 3.
Advances in all phases of root canal therapy have made procedures painless and fast, which results in a much more positive patient experience.
Today, with the use of the operating microscopes and other advancements in root canal treatments, root canals can often be performed comfortably in one appointment.
Dr. Richard Bauman uses the newest technology in root canal and endodontic therapy to help make treatment more comfortable and successful.
If you'd like more information about anything featured on today's program, or if you miss any of the important numbers that will be shown throughout our program, please call 1-800-984-2010. Our staff will be happy to direct you to the medical professional that could be of particular interest to you.